Well, welcome back. It's time for this month's Ask the Expert with Intermountain Healthcare.
Today we're talking about asthma, and we're joined by Joyce Llewellyn, and a respiratory therapist with Intermountain Utah Valley Hospital. And what do we need to know about asthma?
Well, there's three components to asthma. The first one is swelling of the airways, which makes it harder to breathe. Then you get the muscles that go around the airways constrict even more, and then you get excessive mucus production. All of those making the airways smaller and smaller and smaller, making it harder and harder to move the air.
All right, so those are the components. What are the symptoms?
Symptoms could be anywhere from shortness of breath, chest tightness, cough, wheeze.
Let me ask you this. Does everybody suffer from asthma or just a chosen few?
Just a chosen few. Unfortunately, it's those who have a reactive airway. Some things might bother one patient but not bother anybody else. Some of those things might be allergens, exercise, cold air.
I don't know, I get really red and sweaty when I exercise. I think I'm allergic.
Okay. Working out.
Yeah, exactly. Okay, and so those are some of the triggers. How do you know if you have asthma?
There's some breathing tests that they can do.
And you have a little...
I actually have a peak flow meter, and this is something that helps us see how fast we can get the air out of our lungs.
Can I try it?
Yeah, it'd be great. So all you want to do is just put that in your mouth, take a great big breath in, and blast it hard. And then you can see it had a little dial up on top.
Oh, so he did really well,
right? He did really, really well.
I'm a blowhard.
Yeah, he has a lot of hot air. He's full of it.
It has a needle that raises up, and you just want to know what that is when you're feeling good and healthy.
Okay, so let's show this to this camera here. Okay, so are these gauges
Then you would set those based on what this is at.
Okay.
So the top would be maybe 80 to 100% of what his normal is, and then 50% to 80%.
I see what you're saying.
Then you want to look for medical.
Now, do most people use inhalers to fix their asthma, or is there other things out there they can use?
There are two inhalers that probably two different classifications. One is an inhaled steroid, which works great for reducing that swelling, which is one of the main components. The other one is what we call a quick relief inhaler, which helps go in and relax those muscles around the airway so that it makes that airway bigger. And this works within just 10 to 15 minutes. So if they're really having a hard time breathing, they want to use this
And that's the way to go.
right away.